Hi, I'm Emily Mackler, and I'm a clinical pharmacist that works at the University of Michigan Cancer Center in the Symptom Management and Supportive Care Clinic. And today we're going to talk about pain management and dispel some myths surrounding the treatment of pain. Unfortunately, pain is a symptom that many patients with cancer may experience at some point during their diagnosis or treatment of their disease. In many cases, we're able to control the pain, and how we control it can vary from patient to patient. And so it's very important for you to work with your healthcare provider and talk to them about goals of pain management for you. For instance, we may have patients that their goal of managing their pain is to allow them to sleep better at night, or perhaps their goal of managing their pain is to allow them to do certain activities during the day without experiencing the pain during those activities. So really defining what your goals are can help your healthcare provider treat you as best as possible. People often associate the treatment of cancer pain with opioids or narcotics, and we'll talk a little bit about the myths surrounding those agents in a minute. But besides narcotics or opioids, there are many other ways that we can manage cancer pain. Sometimes just the management of your cancer itself can help to eliminate or decrease pain that you experience. In other cases, we can do an interventional procedure that may have nothing to do with taking oral medications, but can prevent or block some of the pain that you're experiencing in a particular area. And so those are just two examples of ways that we can manage pain, but we have multiple other avenues of treating it. Many of our patients have expressed to us that they have concern when they take narcotics or opioids because they have concern that they'll become addicted. We hear from patients who may have a history of addiction in the past, say perhaps to alcohol or to other products, that they're very concerned that they'll become addicted to their pain medications. Addiction really is a psychological dependence on these medications for reasons other than the therapeutic reason of you taking it to manage your pain. And for that reason, the risk or the potential for a cancer patient with pain to become addicted to opioids is incredibly low. In fact, these drugs are very important in managing pain and allowing, as I indicated earlier, allowing patients to be able to improve their quality of life or meet some of their goals as far as activity level or being able to sleep better. So we don't really see the psychological addiction occurring with these medications in cancer patients. Another concern or myth that we hear from patients that we treat within our clinic is that they don't wish to start managing their pain until they feel it gets really bad. There's a concern that patients will run out of options for their pain medications if they begin treatment now, and that's definitely not true. We have a lot of room to go as far as changing doses of the medications that we give patients. Although patients don't, as I indicated earlier, develop an addiction to the medications, a tolerance can develop, but in those cases we can modify dosing or modify the types of drugs that we give you, and that can again be eliminated, and you can achieve good pain control regardless of when you started your pain medication. And so that's a myth that we frequently try to dispel in that we don't want patients waiting too long to treat their pain, and we really don't see that they run out of options, as we have many available interventions or medications that are available to you. So besides narcotics or opioids, we have an array of medications and other treatments that we may use for the treatment of pain. Some patients are very surprised when they hear that they may be started on a medication that is typically used to treat epilepsy or seizure disorder, or for instance a medication that's standardly used to treat depression also can treat and modify patients' pain. So when your provider assesses your pain and sees what type of pain that you have, you may see that as opposed to just being on an opioid agent, that you may be on that in combination with an antidepressant or another type of medication. It's important to use these other drugs to help manage your pain because they treat your pain in different ways. And so we often call that adjuvant therapy and add that on to the standard opioid treatment. In other ways, this is useful because it also may decrease the amount of opioid therapy you need over time if these other mechanisms work well for you. I also mentioned in the beginning that we can use other interventions, and so we have within our symptom management clinic, and working within the cancer center a pain management service that can look at if there are procedures that might be helpful to patients. We also know that in some cases massage therapy might be useful, or other means of treating pain that may not be medication related alone. All of these things are important to consider, and we encourage you to talk to your healthcare provider about ways of treating and managing your pain. Again, about what your pain control goals are and how we can help you to achieve those to the best of our ability. If you have any more questions about this or have any other thoughts regarding your pain control, please contact your healthcare provider or feel free to make an appointment in the Symptom Management Clinic.